Hello guys, so now we shall be discussing regarding the pleural cavities. Okay, so a topic of discussion would be regarding the pleural cavities. So regarding this pleural cavities, what are the important things you need to understand? So the important things are, first of all, let us look at the thorax completely and see what are the different kinds of compartments we have got in the thorax. Okay, so for example, if I am making a transverse section of my body and if you are looking from the top, so how does the thorax look? We shall look into that, right? So basically this would be the picture, right? So this is the thorax like this, and this is the part, right? So this is how it looks from the top view. So in this top view, right, obviously there is something called as anterior and posterior. All of you know. Anteriorly, what do we have? Anteriorly we have got sternum. Posteriorly, what do we have? We have got vertebra. Okay, for example, let us say this is the sternum, this is the vertebra on the posterior side, right? But whatever it is, our point of discussion right now will be that we shall divide this entire region into three compartments. For example, you see, these are the three compartments. Now, what are these three compartments? What are these three compartments, guys? So, one compartment which is on the right hand side is called as a right lateral compartment. One which is on the left hand side is called as a left lateral compartment. So, this will be your right lateral compartment, and this is called as your left lateral compartment. So right lateral and left lateral compartment, and all of you can very clearly look that the compartment that is located exactly in the center, this yellow color shaded area, whatever I'm drawing right now, this is called as the middle compartment. What is this compartment called? This is called as the middle compartment. So how many compartments we have got? We have got the right lateral compartment, we have got the left lateral compartment, and in the center the compartment is called as a middle compartment. So in the right lateral and in the left lateral, this is the place where the lungs are located. Okay, and in the center, in the mediastinum, in the center of the mediastinum, in the middle mediastinum, you have got the heart. So in the right lateral you have got the right lung, in the left lateral you have got the left lung. Okay, so let us draw this picture once again and explain you where are these lungs located and what are the pleura over here, right? So this is the surface, and here as I have already told you that in the middle you have got compartment here. This is called as a middle compartment. Middle compartment is also called as mediastinum, right? This middle compartment is also called as what? It is also called as mediastinum. Middle compartment is also called as mediastinum. Now here if you see, you have got your lung like this. This is your right lung, and here it comes your left lung. So one is the right lung and another one is left lung. Then what is this part here? This part is called as the root of the lung or hilum of the lung. What is this? Root of the lung or hilum of the lung. Now let us see what are the pleura that are located surrounding the lung. I hope all of you know about this pleura, right? So all of you look here now. This pleura which is closely attached to the surface of the lung, which I'm drawing right now in front of you, right? So if you look at the lungs, these are called as I already told you, root of the lungs, right? So here surrounding this we have got a pleura, right, that is exactly attached to the surface of the lungs. So as it is attached to the surface of the lungs, we are calling this pleura as a visceral pleura. Okay, surrounding this visceral pleura we have got another pleura which is lining the innermost, right, it is lining the innermost part or innermost surface of the thoracic cavity. This black color one is your thoracic cavity. So it is lining the innermost part of your thoracic cavity, right? So this pleura is called as your parietal pleura. So here we have got two different types of pleura. So which is lining the innermost part of the surface of the thoracic cavity is called as parietal pleura. And the surface which is lining the lung is called as visceral pleura. Visceral pleura. Okay. Now after this, there are different kinds of pleura here. Okay, pleura are divided into different types. So what are the different types of pleura? We shall discuss it right now. So here I hope these two things you have understood, that this is something that is completely basic. Okay. Right. So here, as I've already told you, this is your lung. Right. So this part over here is your lung, like this. This is your lung. As I've already told you, in the lung here, we have got a pleura. You see this pleura, which is covering the surface of the lung. This pleura, what pleura do you call it as? You call this as a visceral pleura. You call this as a visceral pleura. And after that, this pleura which I am drawing right now, which is lining the inner surface of the thoracic region, right? So this pleura is called as your parietal pleura. Okay, visceral pleura and parietal pleura. And next important thing is that this is the inner surface of the thoracic cavity, right, or the rib cage. So this is the rib cage, like this. This is the rib cage, and obviously these are your intercostal muscles. These are your intercostal muscles. Okay, and not to forget that here you have got your diaphragm. Here you have got your diaphragm. Now here you can find some very important things. See this part of pleura, I am shading it right now, or if you look here, see this part of pleura which I am shading it right now, right, or this part of the lung, let us say, it is facing which side? It is facing the center region, yes or no? What is this center region called as? The center region is called as mediastinum. So this entire surface which I have highlighted with the green is facing the mediastinal surface. So that is why this side, the pleura, you call it as mediastinal pleura. Okay. So what I am trying to tell you is that here we have got different kinds of pleura. For example, see this pleura, this part of the pleura which is facing towards the center, that is a mediastinum, is called as mediastinal pleura. Is called as mediastinal pleura. Okay. Next, this part of the pleura which is facing on the top, cervical region, this is called as cervical pleura. This pleura is called cervical pleura. Next important thing, this part of the pleura which is facing the thoracic cage, right? This is called as costal pleura. What is this called as? This is called as costal pleura. And finally, this part of the pleura which is facing the diaphragm is called as diaphragmatic pleura. Diaphragmatic pleura. So how many pleura we have got in total, guys? We have got 4 important types of pleura. What are these 4 important types of pleura? We have got, one is called as the mediastinal pleura. Mediastinal pleura. We have got the cervical pleura. We have got the costal pleura. And we have also got the diaphragmatic pleura. Diaphragmatic pleura. So we have got quite many different types of pleura, 4 different types of pleura, right? Now after discussing the pleura, we should also discuss some important things. These are called as recesses. What are these recesses? Now after discussing this pleura, we should also discuss some of the very important structures. There are 2 important structures here. These all called as recesses. What is this recesses? Recesses, in the sense, all of you know that this is your pleural cavity, right? Between the parietal and visceral pleura, this cavity is called as your pleural cavity. Now this pleural cavity is having around 5 to 10 ml of pleural fluid. Normally we have got pleural fluid in it. How much it is? 5 to 10 ml. If the pleural fluid quantity is increased, that would lead to another condition. I'll tell you in a minute. But before that, you should know that it is containing pleural fluid. Now some of the areas in the pleura are expanded. For example, see here, this area in the pleura, right? This area in the pleura is expanded like this. Okay. In the same way, you can also figure out one more area in the pleura which is already expanded. See, one is this. This is expanded. Now this expanded region, where is it? It is present between your costa, between your diaphragm. So can I call this recess or expanded pleural cavity as costodiaphragmatic recess? Because it is present between costa and the recess. Next important thing is, you can also see some expanded portion here and here also, right? So these two portions are towards what? Mediastinal pleura. So this kind of recess is called as costomediastinal recess. So how many expansions of pleural cavity we have got? We have got two expansions of pleural cavity. One is called as a costo. Let me write it down. See, this one over here, you call it as the costodiaphragmatic recess, right? And next, this one over here is called as the costomediastinal recess. Okay, so costodiaphragmatic recesses and costomediastinal recesses. So these are the two important recesses we have, or expansions of pleural cavity. Why do we need an expansion of pleural cavity? Because whenever you are inhaling the air inside, whenever you are inspiring the air inside, the lungs should sufficiently expand. For allowing the sufficient expansion of the lung, you need these expanded pleural cavities. Okay. Now, there is also one clinical point here. I'll tell you what is that clinical point in a minute. But before that, you just have to know one important thing, that write down first of all, what do you mean by a recess? Recess is nothing but an expanded pleural cavity. Expanded regions of pleural cavity. You call this as pleural recesses. Pleural recesses in the sense there is expansion of pleural cavity. And why do you need this? You need this because they help in expansion of the lung during inspiration. They help in expansion of lung during inspiration. This is the function of the recess. Okay, right. Next important thing here. The next important thing is that, as I have already told you, that the amount of fluid that is located within the pleural cavity, how much amount of fluid? That is 5 to 10 ml of fluid. So this fluid you call it as serous fluid. What kind of fluid you call it as? You call this kind of fluid as serous fluid. And how much it is? 5 to 10 ml. There is 5 to 10 ml of serous fluid in the pleural cavity. 5 to 10 ml of serous fluid in the pleural cavity. For example, if the serous fluid quantity is increased, what will happen? What will happen is that this extra amount of fluid, whatever is there, it starts accumulating within this recess. So when it starts accumulating within this recess, what will happen? This fluid will push the lung above. Okay, so it is pushing the lung from the lower surface. So it is pushing the lung up. When it is pushing the lung up, what will happen? If you look at the border of the lung is decreased in this way. Okay, so this entire region is completely filled with the fluid here. This condition you call it as pleural effusion. So let me show it to you. The X-ray here, very clearly I hope you can figure out this X-ray, that exactly near the costodiaphragmatic recess there is excess amount of fluid. See, all this white part is the fluid. Because of this fluid has pushed the lung above. So that is the reason why there is a curve like this. So whenever in an X-ray you see an upward curve in this way, that is pleural effusion. Okay, so from now onwards, whenever you look at such X-rays like this, so just keep in mind that this is an X-ray of a pleural effusion. Okay, what is this? This is an X-ray of pleural effusion. So in pleural effusion, if someone asks you where does the fluid accumulate, what will you tell? The fluid accumulates in costodiaphragmatic recess. Okay, the fluid accumulates in the costodiaphragmatic recess. And by the way, did I write it? How much amount of fluid is normally present? Around 5 to 10 ml of the fluid. Right. Now, if you look at what are the different kinds of nerves that are supplying this pleura. Okay. So, what are the different kinds of nerves that are supplying this pleura, guys? So, here itself I'll write it down. For example, okay, let me draw this part over here so that it would be easy for you to understand. So, let us say this is your surface of the lung. Okay. And very quickly I'm drawing it. This is your visceral pleura. Right, this is your visceral pleura, and obvious this is the recess, and this is your parietal pleura. And yeah, I'm sorry, I should also draw the recess down. This is a parietal pleura. Okay, and there is no surprise that all of you know that here we have got what? This is your vertebra, not vertebra, these are your ribs, right? And in between the ribs, here you have got what? Here you have got the intercostal muscles. Right, now if you look at what are the nerves that are supplying here, if you look here, see here guys, so this area which I'm shading right now, see this green color area which I'm shading right now, now I'm telling you about the nerves of parietal pleura. So this part of the parietal pleura all the way from here till the half part of the diaphragm. Okay, so all of you know that here you have got your diaphragm, right? So which is the part which I have covered here? I have covered the entire surface. This is also called as the costal surface. I have covered the entire costal surface, and also I have covered only the half part of the diaphragmatic surface. So the costal as well as the half part of the diaphragmatic surface, whatever it is, this part of the parietal pleura, whatever is there here, this is supplied by a nerve called as intercostal nerve. Okay, so if I have to write it down, how will I write it down, guys? I will write it down like this. For example, costal plus peripheral part of diaphragmatic pleura. Peripheral part of diaphragmatic pleura. Both of them are covered here, right? This part of the parietal pleura is supplied by intercostal nerve. Intercostal nerve. Okay, so this part of the parietal pleura is supplied by intercostal nerve. Then what about the remaining part? Remaining part in the sense, see all the way from the central part of the diaphragm. So previously the peripheral part. Now I am telling you the central part of the diaphragm, right? And if you go up here, the mediastinal part, the central part as well as the mediastinal part, this yellow color shaded area. So this part of the parietal pleura is innervated by phrenic nerve. Okay, so if I have to write it, what will I write it? That is the central diaphragmatic pleura, plus the mediastinal part. Central diaphragmatic pleura plus the mediastinal part is innervated by phrenic nerve. Is innervated by what? It is innervated by phrenic nerve. So here if I have to tell you two important things, what can I tell you? I can tell you two important things here, that what is the nerve innervation of parietal pleura. So guys, specifically speaking about the parietal pleura is innervated by two nerves. So one nerve is called as an intercostal nerve and the other nerve is called as a phrenic nerve. So intercostal nerve mainly it innervates the costal part of the parietal pleura as well as the peripheral part of the diaphragmatic pleura. Right, you can see this green color part, and this yellow color part is the central part of the diaphragmatic pleura as well as the mediastinal pleura. Right, so all this is innervated by the peripheral intercostal as well as the phrenic nerve. But when it comes to Visceral pleura, when it comes to visceral pleura, right, visceral pleura is mainly innervated by two important nerves, right? So what are these two important nerve systems here? One is called as sympathetic, another one is called as parasympathetic. One is called as sympathetic and the other one is called as your parasympathetic. Sympathetic in the sense all the way from T2 till T5 is your sympathetic. Parasympathetic in the sense it is your vagus nerve. Vagus nerve is your parasympathetic. Okay, so now you understood the nerve innervation of parietal pleura as well as the nerve innervation of the visceral pleura. Now if you look at the parietal pleura, let us write down what are the arteries that are supplying this parietal pleura. Okay, so if you look at this parietal pleura, what is the arterial supply of this parietal pleura? Just remember it as PIM. Okay, just remember it as PIM. What does P stand for? P stands for pericardiophrenik artery. Pericardiophrenik artery. What does I stand here? I stands for intercostal artery. I stands for intercostal artery. Okay, and I also stands for internal thoracic artery. Internal thoracic artery. I don't want to draw the picture especially for this blood supply and complicate the things here. So if you remember just these three words, that would be more than enough for this. Okay, so some pictures are worth to draw because I have to explain you the structures, the relations and all. So for them I'll draw the pictures. For everything pictures are not necessary over here, right? So PIM, M stands for musculophrenic artery. So what are the 4 important arteries which you have got? You have got the pericardiophrenik and intercostal, internal thoracic and musculophrenic artery. Now after this, if you look at the visceral pleura, what is the artery that is supplying the visceral pleura? There is only one artery, that is called as bronchial artery, right? Bronchial artery. Okay, so this is the nerve innervation as well as the blood supply of your both parietal as well as the visceral pleura. Okay, now if you look at the differences between the parietal pleura and visceral pleura, we can make out two important differences here. So what are these two important differences are? Parietal pleura, if you look at parietal pleura, there are two very important points. Parietal pleura is sensitive to pain. Why? Because there are pain receptors. But visceral pleura is not having pain receptors, so it is insensitive to pain. So this is sensitive to pain. Okay. Whereas visceral pleura is insensitive to pain. Okay, what is the next important condition you can tell? This parietal pleura develops from somatopleuric mesoderm. It develops from somatopleuric mesoderm. Whereas this visceral pleura develops from splanchno-pleuric mesoderm. Okay, it develops from splanchno-pleuric mesoderm. So you have to know from where parietal and visceral pleura developed. Okay, so these are two important things which you need to know. Now apart from this, what are the additional clinical points that I can discuss here? Now there are two important clinical points, right? These are very important in your respiratory medicine when you study in future subjects in surgery as well as in the medicine also. The respiratory part, this is very important. Now this is pneumothorax. There are two important types of pneumothorax. One pneumothorax is called as spontaneous pneumothorax and the other one is called as traumatic pneumothorax. So what is this spontaneous pneumothorax? What is this traumatic pneumothorax? We shall look into that. Okay, for example, let us say this is the surface of your lung. Okay, and all of you know that this pleura which I'm drawing right now is your visceral pleura. Visceral pleura. And after that, this pleura over here which I'm drawing right now is your parietal pleura. This is your parietal pleura. And after that, these are your ribs over here. These are your ribs. And obviously, you very well know that here we have got intercostal muscles. Now, normally within the pleura, you have got no air. Okay. So, within the pleura, the pressures are in minus. Okay. And within the pleura, you have got fluid that is called a serous fluid. Now, in some of the individuals who are thin, who are tall, okay, in some of the individuals who are thin and tall, in those patients, what will happen is that there are some small air bubbles that are present. Okay, these air bubbles are called as bullae. What will happen is that these bullae, they will join together and form a very big air bubble like this. Okay, now what will happen in the next step? This bullae will rupture. What will happen? This bullae will rupture. Now, because of this, the pneumothorax which is developed is called as spontaneous pneumothorax. And what this bullae will do, once all this bullae, they will join together, right? They keep compressing the lung. Okay, so this is how the bullae develop, and this is most commonly seen in people who are tall, people who are thin, and people who are smokers. Okay, so if a tall person who is very thin and is smoking a lot, so you will come across this condition. Okay, so the first important condition which you need to know, that in these patients what will rupture, that is bullae will rupture of this bullae. Second important condition is that, for example, let us say someone with a knife wound, right, with a knife, someone has punctured your lung like this. Repeat. Second important example is that, for example, someone has took a knife and stabbed you in the chest. What will happen? Obviously, there is a air entry into the pleura. You see this part. So this part, what is going to happen here? In this part, exactly, you see the air that is entering inside like this. Okay, so oxygen, the air that is entering inside, and this air starts depositing within the lung. Not only deposits within the lung, what does it also do is that this air will also push the lung surface. Okay, so what will happen? What will happen is that, if you can see, the lung is completely compressed here. Why? Because there is a lot of air here. Okay, so now can I tell the lung volume is decreased? Yes or no? The lung volume is reduced significantly. When the lung volume is reduced, do you think patient will breathe normally? No. He will have sudden onset of dyspnea. Suddenly he will have very difficulty in breathing. So if you see any patient who is having injury to the chest, right, and he is having sudden onset of dyspnea, right, sudden onset of breathlessness, then you need to think that this patient is having open pneumothorax or traumatic pneumothorax, and this pneumothorax is also called as a tension pneumothorax. Okay, so you can think of open or traumatic pneumothorax. Okay, now very easy way to find out how to look at this tension pneumothorax or traumatic pneumothorax is that, if you look at an x-ray here, guys, right, so let me zoom in this x-ray. If you look at this x-ray from the center to periphery, can you see some fine threads that are going all the way till the periphery? Yes or no? See these white color threads, can you find them? These white color threads are all the way traveling till the periphery. Yes or no? See these white color threads, whatever you can see here, right? So all these white color threads are to the periphery. Some reticular pattern is till the periphery, right? Now look at this x-ray here. In this, on the left side, if you look, obviously these white color threads are till the end. But here, look at the right side. The white color threads are only till at a certain point here. But here, do you find any white color threads? No. Why? Because this entire area is occupied by air. That is why it is completely clean. So whenever you see such x-ray, then you have to think that it is a pneumothorax. So in this patient, it is a right-sided pneumothorax. Now if you look at this x-ray also, you can see this white color reticular pattern going all the way till the end. But look at the left side. From here, right, from here till here, I don't have any white color reticular pattern over here. Here also I don't have anything. Here also I don't have anything. You see, this is the lung which is compressed. So this is a case of pneumothorax. Okay, so this is how the x-rays of pneumothorax are very easy to diagnose. Okay, so if you look at the things which we just spoke now, here we were discussing about the pleural cavities. Okay, we were actually discussing about the pleural cavities. I already told you that the middle compartment is also called as the mediastinum. Okay, next when it comes here, two kinds of pleura, parietal as well as visceral. So two kinds of recesses we have got. One is called as a costodiaphragmatic recess and the other one is called as a costomediastinal recess. And how many different types of pleura we have got here? We have got, one is called as the the cervical pleura, costal pleura, right? And lastly we have got the mediastinal pleura. Got it? Mediastinal pleura. So these are all the different types of pleura which you have. One you have is the mediastinal, another one you have is the cervical pleura, next you have got is the costal and the diaphragmatic pleura. Okay, so what are recesses? Recesses are nothing but the expansions of the pleural cavity. Next, how much amount of serous fluid do we normally have? Around 5 to 10 ml. Okay, so here also two important nerves to remember. One is called as your intercostal nerve, another one is called as your phrenic nerve. And next, coming to the visceral pleura, two important innervations, T2 to T5, that is the sympathetic as well as the vagus nerve. Okay, and these this is a very important table, guys. So this table indicates the arterial system which you basically have in these patients. Okay, so this is the thing which you need to know regarding the pleural cavities, right, and the pleural spaces and all. So thank you so much for watching my video. Goodbye.